Good afternoon, and welcome to the City of Memphis and Shelby County Joint COVID Task Force press briefing for March the 23rd. I'm David Sweat, Deputy Director of Shelby County Health Department, joined today by Doug McGowen from the City of Memphis. To jump right into the data, right now in our area in Tipton County, we've had 7,075 cases reported so far in the epidemic. We've had 4,762 cases reported in Fayette County. DeSoto County in Mississippi has reported 20,245 cases, and Crittenden County in Arkansas has 5,478 cases reported. Here in Shelby County, we're at 90,396 cases have been reported, including 85 new cases that were reported yesterday. We've had a total of 1,546 deaths reported through this epidemic. And in the vaccine front, on the vaccine campaign, so far 255,000 doses of COVID vaccine have been administered in Shelby County to residents. 177,191 people have received one dose, and 77,809 people have been fully vaccinated with two doses of either the Moderna or Pfizer vaccine. In terms of other information that's important to mention, we do have and have been able to document that variant strains of COVID are spreading in the community. We know that that is the case because of the screening and sequencing that has gone on at the UT Health Science Center, and we've seen an increase in the number of variants that are being detected. So we know that there is an increase in spread in our community of the variant cases, particularly the B117 cases from the United Kingdom. Fortunately, that variant strain that is spreading more widely is also susceptible to vaccine. And the vaccine will protect against normal wild-type Wuhan and the UK variant. So for an update on where we are with the vaccine campaign, I'm going to invite Doug McGowen to come and give us that update at this time.
Thank you, David, and I appreciate that. I just checked the data on the way over, and so we're a little over 260,000 now. David reports what's in tennis, and based on what we did last night and this morning, we're over 260 now, so that's really good progress. So I'll talk a little bit about how we've done that this week, last week, and what we're doing next week, and then I'll give you a bit of an update on the way forward. So last week, in addition to doing more than 30,000 doses through our fixed site pods, our community partners also delivered about 5,000 through our healthcare systems. And then we also had community-based pods in partnership with the World Overcomers Church at the Hickory Ridge Mall down in Hickory Hill. We had a pod in Fraser through the Memphis Fire Department Training Academy, and we did about 2,000 doses at those sites. And then we also finished up vaccinating folks who had attended pods at the Anointed Temple of Praise and the Cane Creek churches, as well as the Bartlett school teachers. We did all of that last week, and the partnerships worked out really well to get a bunch of people fully vaccinated. This week, we're delivering, again, another more than 30,000 doses through our fixed sites. Our medical partners will deliver nearly 8,000 doses through all of their work, and that is the community pharmacies, as well as the hospital systems, dialysis clinics. We're hosting second dose sites at the Achievement School District, as well as Arlington and Lakeland School Districts, so we'll have all of their teachers vaccinated. Our Catholic diocese and independent schools are in partnership with one of our healthcare systems. We'll be doing second dose vaccines for all of their teachers. So again, many of our teachers will be fully vaccinated by the end of the week. We're also holding a first dose community pod in Orange Mound this weekend in partnership with Mount Pisgah and Mount Moriah East churches. That will be held at the Melrose High School parking lot. So look for that coming this weekend. And then next week, we're going to continue our community partnership in pods, and we'll be offering 4 separate pods, one at the Healing Center in the 38118 area, one at the Golden Gate Church, which will serve North Memphis and South Fraser, one at the New Baptist Church in the 38106 South Memphis area, and then one at St. Paul Baptist in the 38116 area. Again, I've talked to you all a little bit about how we track the data. David and his team do a really good job of aggregating that and then putting it on a map so we can see zip codes that are underserved. And that's how we decide where we will put these community pods, in addition to having a willing partner, and we're very thankful for all the willing partners that we have. Additionally, at the first part of next week, we will complete second-round vaccinations for all of the Shelby County school teachers. So by about Tuesday of next week, all of the teachers in Shelby County should have received their vaccinations and be ready to continue with their teaching duties for the rest of the year. So let's talk about what's next. You've heard some talk on social media and an announcement yesterday that we are today in phase 3 and age 45 and up. We have been given permission from the state to move forward at the pace that we believe is appropriate. And so because we had seen a dwindling demand from the other phases, and we had some additional appointments available this week, we decided to move to phase 3 and age 45 and up. And so I encourage you, if you are in phase 3 or you're 45 years and older, to please take advantage of the several thousand appointments I still have available this week, from today all the way through Saturday. Now, moving into next week, we will open up vaccinations to all adults ages 16 and up. And I want to put a fine point on that. It depends on the type of vaccine you receive is the age limit. So if you are 16 and up, for 16-year-olds, they can receive the Pfizer vaccine. You must be 18 years old or older to receive the Moderna and the Johnson & Johnson vaccine. Now, the good news is the preponderance of the vaccine we have in the community is the Pfizer vaccine, but I just want to put that note out there. Why are we making the move? Well, our aim is to get as many shots into as many arms as fast as we possibly can. And the phenomena that we were seeing was not only were we not having all of our appointments filled, but we were having people double book and triple book appointments and then being no-shows. And so it was not as efficient, and we were not as vaccinating, again, our goal, as many people as fast as we possibly could. And we have done some research and talked with some other communities. We've also heard from the CDC that when you see that first drop in demand from a phase that's in front of you, you should immediately move to open up to another phase, and that's what we're going to do. So, again, as we look forward, we're going to get as many shots in his arms as fast as we can. And with your help, we've been able to do that to this point. And I want to really talk about how successful the vaccination campaign has been here. Through our fixed site pods, our community pods, and our healthcare systems, we have done a significant number of vaccinations. And as you know, about 2 weeks ago, we opened that up to our community pharmacies and our medical clinics. We have, to this point today, worked through all of the inventory that we had previously had on hand. We've also, in addition to working through the inventory that we receive each and every week, we get a fair share from the state. We are taking that in and we are putting it out, both first and second doses. But in addition, we asked for and received an extra 20,000 vaccines here in Shelby County. The pace that we are on, we anticipate that going into Easter weekend and the MLK weekend, which begins on the 2nd of April and goes through the 5th, that we will have far surpassed 300,000 doses administered, and that we will have exhausted all of the supply that we have on hand for our public pod sites, and we'll be in the position coming out of the Easter weekend to be ready to expand our capacity and expand our offerings of vaccines as we receive new vaccines that very next week. So we're right at the position here where we, going into the Easter weekend, will have exhausted our supply. We will be receiving new doses, and we anticipate that week on or around the 5th, 6th, or 7th, still to be determined, that we will see a significant uptick in the number of vaccines that we receive here in Memphis and Shelby County. Now, we're ready for that. We're ready to expand our ability to administer those vaccines so that it matches exactly the number of vaccines that we have. So the good news here, we're opening it to all adults. The better news, we will have more vaccine coming to Memphis and Shelby County that first week of April, and so we show no signs of slowing down here in Memphis and Shelby County. We expect to open appointments for next week for all adults this Friday at about midday, so you should be looking for those appointments. And I realize for next week, our demand will far outstrip the number of doses and the number of appointments that we have. But again, I want to fill every single appointment that we do have next week, and I want people to be looking forward to that first week of April when, again, we will have more vaccine. We expect to have more vaccine, and we expect to have more appointments available for everyone to take advantage of. Again, today, I still have several thousand appointments available this week, so anyone who is age 45 and up or in phase 3, please make yourself or take advantage of those appointments that we have available the balance of this week. And you can go online to do that at covid19.memphistn.gov, or you can call the 222 SHOT line. And so with that, I'll pause and take any questions that folks may have.
Brad Broders, Local 24.
Thanks. Good afternoon, Doug. Thanks for the update as always. Just for people out there, my first question is, what's the message to the public? Obviously, there's going to be a huge demand on Friday when those appointments open midday. What's your message to the public about maybe how long they may have to wait for the appointment slots to be filled? And I have a follow-up.
Sure. So I will say that the President Biden had said that by the 1st of May it would be available to all adults. We are obviously opening it to all adults before then. We believe that there will be an uptick in our vaccine availability about that first week of April, which will allow us to go from today, as you know, we're doing about, as I mentioned, about 40,000 doses a week to north of 50,000 doses a week. And so we will have fully a month before the president has set his goal of all adults being able to have access to a vaccine appointment. We'll have done that about a month prior. So I'll ask for a little bit of patience. Again, our goal is every vaccine that I receive is matched to an appointment. Every appointment has a person that fills that appointment. Nobody has to wait an excessive period of time, and that's how we will be most efficient and effective. I wish I could tell you that I would receive all 300,000 doses in 1 week and we could do that, but that's not the pace we're going to be on. As I said, we'll receive a significant uptick, but it's not going to be enough to do everybody in 1 week or even 1 month. And so I'll ask for a little patience. May 1st was really the deadline. We're accelerating that here locally and in the state. So we'll ask for folks to please take advantage of the appointments we do have.
Thanks, Doug. And as my follow-up, is there any kind of ahead of the Friday opening of these appointments, have there been any extra safeguards in place in terms of the sign-up genius, call operators, et cetera? And my second part of that is, if you're a 16 or a 17-year-old, do you need parental consent to get a vaccine?
Yes. Yes to the second question and yes to the first question. We do have some safeguards in place, if you will. We have worked with the call center. As you know, it's a state-run call center. They are essentially going to double the number of call takers as we move into this phase. So we anticipate there will be less wait time if you do call the number. We're also hopeful, though, that as we open this up to folks in the younger ages, that folks will be more willing to go online and schedule their appointments. So the demand for people to call in and get an appointment may be a little bit lower than it was in some other age groups where folks are not as tech savvy. So those safeguards are there. We have been working with Sign Up Genius to make sure that the platform is stable and that we have enough bandwidth there to absorb the number of appointments. Again, I don't want to overpromise here. You will see our appointments every week go from something like 30,000+ at our public vaccine sites to 40,000+ at our public vaccine sites, in addition to what the medical offices are doing, the healthcare systems, and the other partners in the community. So there will be an uptick and an increase in appointments, but it's not going to be anything like double or triple.
Kelly Roberts, WMC.
Good afternoon. First, let's see, Brad asked some of my questions. So how about, can you talk about numbers of allocations? I know, so it sounds like going into kind of the Easter holiday, we could finally be reaching that 50,000 vaccines given in a week. How many are the county getting this week? How many will they get next week? Do we know those numbers yet?
Yes. So remember, we had some inventory on hand. We asked for an additional 20,000, and every week we get it's roughly 19,000 new first doses, and then we get second doses that come on the heel of that about 2.5 weeks later. So the number of doses in aggregate has been around 30,000 if you think about it, from first doses to second doses. And what we have been doing over the last 4 weeks has been taking the inventory we had on hand, plus the additional 20,000 that was given to us by the state, plus that 30,000 that we receive each and every week, first and second doses. And that's what we have worked off to the point where next Thursday or so, we anticipate being out of the vaccine and being ready to start again early the next week with an increased allocation. And so moving into that week, we don't have the allocation yet from the state that we will receive that week. I do know that I anticipate north of 13,000 second doses that week based on the pace of what I'm getting now. And I anticipate, again, a significantly higher number of first doses that week.
Thank you. And this second question may be a health department question, but whoever feels ready to answer it is fine. Yesterday, Dr. Piercy had mentioned that low uptake in the vaccine in rural areas. For example, some counties in rural West Tennessee only have about 20% of the appointments filled to get a vaccination. It reminded me a lot of when we talked about earlier in this pandemic about, transmission, large transmissions in the rural areas and how it may affect us in the metro areas. Obviously, a focus on hospitalizations and that sort of thing. But if fewer people in our rural neighbors are getting the vaccine and we are still not at herd immunity, we're still working toward that, are there some negative effects we may see here locally in the city?
Well, I'll defer that to David or Dr. Randolph if he feels compelled, but I would suggest that I encourage everybody in our entire catchment area here to take the vaccine. That is our protection. So, and we will feel the net result here, as you said very well. We are the medical center for this entire region, and so if the infection continues beyond us reaching herd immunity in Memphis and Shelby County, we will still be the receiver of the problem in our hospitals because people didn't take the vaccine. So, David, you may want to talk about the phenomenon there.
Yeah, thank you very much for the question. I mean, we are concerned. I mean, right now in the hospitals, we're running between 100 and 150 patients with COVID in the hospital. But our hospitals don't just serve Shelby County. They serve North Mississippi, Western Tennessee, Eastern Arkansas, even as far up into southeastern Missouri and Western Kentucky. So we have a broad catchment area, and we'll continue to see cases if we don't achieve herd immunity throughout the region, not just in Shelby County alone. And so right now we're at above 25% of our local campaign goal. Our local campaign goal is 700,000 people, 700,000 Shelby County residents to be vaccinated. But every county around us also needs to achieve 70% of their population being vaccinated in order for the transmission to really become more difficult for the virus in the region. So we certainly, if you can hear our voice, we would say please go get vaccinated if you are eligible where you live. And I believe throughout the surrounding counties, there's broad availability. As you've mentioned, there's in some areas low demand, so it should not be difficult to schedule an appointment, and everybody needs to do it if we want to stop this virus from continuing to spread. This is how we get out of the pandemic, is to get herd immunity through vaccination, so the virus just has fewer places it can even go, and ultimately the pandemic would crash.
Mandy Rock, Fox 13.
Hi, good afternoon. I just have a question about the UK variant cases. So as more of these are detected in Shelby County, what are your concerns with that? And do you expect those number of cases to keep rising, or do you think that they will decline as more people get vaccinated?
Well, that's the $1 million question, right? So what we are seeing is anywhere over, say, February time period, somewhere between 8 to 15% of all of the cases that were transmitted were probably due to the variant strain. But now we're seeing in March that that percentage, at least in terms of the sequenced specimens, is creeping up to like 30%. So as many as 30% of the specimens that have been checked to see what variant strain it is we're finding this UK variant. So what's the problem with that variant? The problem is it's 3 times more transmissible. In other words, 3 times easier to catch. And it's also about 30% more lethal. So it has a higher mortality rate attached to it. So a faster spreading virus that is more likely to kill you is not a good thing. And the good news is that the vaccine that we have will protect against that variant strain just as it does against the wild type virus. So we have a race going on between the virus. How fast can it spread? How fast can it find susceptible hosts? And then the vaccine campaigns. How quickly can we get enough people vaccinated to slow it down? Now, what we've seen in reproductive rate of the virus in all of 2021 so far, we've had a reproductive rate of the virus less than 1, meaning we were shrinking the future epidemic. Each case was producing less than 1 new case. But last week, it came back up to 1. So now each case is creating a case. We're back to maintaining. We're not growing the epidemic. We're not shrinking it any longer. And the reason is most likely due to this more transmissible variant strain.
Okay, thank you.
Sam Hardiman, Commercial Appeal.
Hi, my first question is for Doug. Doug, right now, first doses given outnumber second doses given by a factor of 2. A lot of people have been given a first dose and are going to be needing a second dose. Does the city expect that it's going to have enough second doses available to give everyone that's been vaccinated in recent weeks their second dose in a timely manner, or should people expect waits for their second dose? And then I have a follow-up.
Sure. So that's certainly our intention, Sam, is for everybody who's received the first dose to get their second dose. That is the protocol that has been put into place. I will say that there is a bit of a phenomena where folks are not taking their second dose on the timeline. The earliest is 21 days for Pfizer. The earliest for Moderna is 28 days. Now, it's okay if you wait a few days and even a few weeks after that to receive that dose. It doesn't affect the efficacy of the vaccine, according to the medical experts. But it does make for a bit of a tracking problem for us when you're sitting on a significant number of doses and you have first dose appointments that are filled, second dose appointments that remain unfilled, and so you make the call to say, well, I need to get more shots in arms. So we have done that several times in the past where we had all of our first round doses come to us. This is especially as we had some inventory on hand. We had second dose of appointments available that went unfilled, and our decision was to flip those to first dose appointments, knowing that there is a supply chain coming to catch up. So the answer is yes, we will have a second dose for everyone. The answer is likely yes, that just like some folks had to wait for their second dose Moderna because the supply chain had to catch up a little bit, they may have to wait for their second dose Pfizer, but that is certainly not our intent. Our intent is to allow people who want their second dose to be able to receive it on time. The track record is that people have not been taking it as diligently. I will use myself as an example. I received the vaccine. I was late one day, had an available vaccine. I received it. I was due at the end of last week. I should be receiving my vaccine this week. I have not yet scheduled my appointment. I don't think I'm atypical. So I think that's happening, and that's one of the reasons why we're not seeing the uptake.
And my follow-up is, as it moves to open season, which is what we've all been waiting for in terms of everyone being able to get a shot, 16 and up, does the city and the county have good data on what percentage of eligible groups, either in phase 1A, 1B, have been vaccinated at this point?
Well, I certainly know, and I'll let David talk about that. I certainly know that from an age perspective that we have really good data, and we report that out each and every week. As far as the number of healthcare workers, I believe we have pretty good data on that. As far as the other phases, David, is there anything you'd like to add?
Apart from the workforce data, the only data that we really have about the workforce really dealt with an analysis of healthcare workers and first responders, and we saw that more than 60% of those folks had been vaccinated because it was available to them. We would still like for the rest of them to go ahead and get their shots now, but in terms of ages, that's the easiest to track because the census data is pretty clear about how many people in our community are within those age breakdowns. We know that right now, 58% or more of the people 75 years of age and older have been vaccinated, so almost 60% of those folks, and 52% of the people 65 to 74 years old have now been vaccinated. And we have similar analysis available for all the different age bands down to 16. But in terms of the demographics, we continue to see an increasing proportion of our Black residents getting vaccinated. We're about 33% or so of the doses have been administered to individuals who are Black. We have about 44% to individuals who are white. But the big discrepancy is by sex. Only about 34% of those who have been vaccinated are male. So one of the big challenges we have is our women are taking the vaccine up very well. More than 60% of the vaccine has been administered to women. But we need more guys to come out. Okay, so guys, come on. Let's get our shots. It's going to protect us. It's going to protect our families. It's going to protect our loved ones, our coworkers, our community. We need to get vaccinated, those of us who are men. And so if you're a guy and you haven't scheduled a shot or you've been sort of not thinking about it, this is the time to think about it because it's available, and we all need to do our part to protect the community by getting this shot.
Jane Roberts, Daily Memphian.
Oh, Doug, this is for you. Can you just give us a little history on what the percentage of appointments that have gone wanting in Shelby County might be? And I'm really looking for over the last 2 or 3 weeks, and I think last week was an anomaly because of the weather.
Sure. So we've seen typically, we count return rate of vaccines that have not been administered because they were still in the vial. So approximately 10% no-show. We've actually done a pretty good job of filling the appointments late in the week. So there was probably about 5% of the overall appointments that were never filled, despite our exhortations for people to fill them. And as Sam asked in his last question, many of those were second dose appointments that were left unfilled. So clearly there was not a demand for the second dose there. But so about 10% no-show and about 5% of the vaccine appointments were not filled over the last few weeks. That was a signal for us that it's time to go to the next phase.
Thank you.
All right, we are out of time. Are there any closing messages from any panelists?
So I'll just offer, and I'll let David close out if he would like, but I would offer that, again, we have several thousand appointments available this week for people 45 and up and phase 3 and up, so please take advantage of that. We understand that there is a huge pent-up demand, and so next Friday we're going to start meeting that demand for all adults age 16 and up for Pfizer, 18 and up for Moderna, and for J&J. We still do not yet have an abundance of Johnson & Johnson vaccine here, nor does the state. We anticipate the first week of April is when we should begin to receive that. Also, again, just to reiterate, as we get towards the Easter weekend, we are on a pace, and you all have helped us get there, to exhaust the supply that we have in the public domain, to be ready to receive more that following week with a significant uptick in volume so that we can meet that demand that's coming when we open it to all adults. So we're very appreciative of the folks that come out. We're appreciative of all of our community partners, especially. You heard me mention many of the churches and nonprofit partners who have helped us deliver vaccines in the zip codes where we know people will take it and where they need to take it. And we're also thankful for all of the volunteers and community partners who actually staff the tents, they staff the facilities, they're out there and doing that great work. And a final note of thanks to all of our private pharmacies, the medical clinics, the dialysis clinics, our healthcare partners who are doing their part to really provide access in many, many more places than just through the fixed sites or pop-up pods. There are now more than 60 locations in Shelby County where you can get a vaccine. So please take a vaccine. That is our key to getting out of the pandemic. Thank you.
Thanks, everyone. We'll see you back here on Thursday.